Hello, Masa. Hi, Jessica. Nice to meet you. Have a seat. I'm an occupational therapy student of this hospital. I'm here to answer some questions you may have about Jessica's situation. Well, type 1 diabetes is called autoimmune diabetes. That means her immune system mistakenly attacked her beta cells, a kind of pancreatic cells, and caused the reduction of insulin. This is a kind of hormone that helps control the blood sugar. Researchers have not found a specific cause of type 1 diabetes. It's more like a combination of multiple reasons.
She didn't get it from her
And
aunt.
the risk factors may age, obesity, family history, medication, and so on. Type 1 diabetes is a kind of chronic disease. In Australia, among children younger than 19 years old, 207 out of every 100,000 had diabetes, and the incidence of type 1 diabetes in children younger than 15 years old is 25 out of every 100,000 every year. Although the age of symptomatic onset is usually during childhood or adolescence, symptoms can sometimes develop much later.
It will not go
We
away.
can manage the disease very well. It may not have major consequence on her health and life. To diagnose the diabetes, the most direct sign is her blood sugar. So she needs a blood sugar test called the 2-hour blood sugar on OGTT. She will drink her glucose solution. 2 hours later, her blood glucose level will be measured again. If her result is more than 11.1, that means she has diabetes. If we want to know how serious the situation is, she needs more assessment to test her vision and different body systems. You may have seen the classical symptoms of type 1 diabetes on her. She drinks more, goes to the toilet more frequently, even has bad waiting in the night, and loses her weight a lot. They are all caused by the reduction of the insulin, which is responsible for absorbing food and control her sugar level. If there is too much sugar in her blood, that may cause diabetic ketoacidosis or hypoglycemia. During that time, she always wants to sleep and vomits. The rate of her breathing may increase and she may smell like rotting fruit. If there is too little sugar in her blood, that may cause hypoglycemia. That happens when her blood glucose falling below 3.5. During that time, you can see her face become very pale. She can even lose consciousness rapidly. All of these situations are very serious and may threaten her life. If this happens, she should be sent to a hospital immediately. Since type 1 diabetes is a systematic and chronic disease, it may attack other parts of her body. For example, the cardiovascular problem may cause chest pain or breath difficulties. Some vision problems may cause blood sight, and she may feel tingling in feet and fingers. The higher blood sugar increases the tendency of infection, but these complications can be avoided if we can control the blood sugar well. Well, don't worry. What we can do now is try our best to manage the symptoms. The most important thing is to administer the insulin 30 minutes before every meal. If we can insist doing that, let her blood sugar maintain in the standard range, she can avoid many consequences and symptoms. Yeah, it's the only way that we can do to manage the disease. Other efforts are to monitor the situation. The first thing is to self-test the blood glucose 4 times a day. Blood glucose is the direction sign of her situation, so it's very important. Unacceptable standard are more than 7.7 before meals and more than 11 after meals. If she can manage her blood sugar very well after instructing by her doctor, she can reduce the frequency of blood testing so that the influence of disease to her life will decrease. That's a better outcomes. Besides, to maintain health, you should manage her diet depending on her weight and increase the proportions of vegetables and fresh food. And you should let her bring some sugars or snacks before going to school, so that if she feels dizzy, she can increase her blood sugar.
She cannot eat normal food like other child because she cannot control her blood sugar by herself.
And the other thing is being mindful about if she has other symptoms in other parts of her body. Especially minor injuries such as cuts, they can become major problems through poor healing. Some people even have to cut off their feet. That's a really poor outcome. That you are experiencing a hard time now. As a single mom, you have to look after 2 children while fighting with depression. So you are really amazing. Since you find her situation in a timely manner, we can give her treatment as soon as possible. But a good family environment is very important. If you feel stressed, she can also feel that. That can cause her not to adhere to treatment. You might not have much energy and money to help her manage a situation as well as you would have liked. But don't worry, we can work together. If you want to get more help, you can also join self-support groups so that you and Jessica can find that you are not alone. Since she's only 8 years old, she cannot manage herself very well, and she spends lots of time at school. Teachers may be too busy to remind her administer the insulin and pay attention to her situation. They may not know how to solve an emergency situation. Besides, Jessica may also get pressure from her peers. All of these barriers may cause her to forget or make her unwilling to adhere treatment plans, and that may make the situation worse. So you should make sure that Jessica has a management plan for school and communicate with school staff frequently. Because of the disease, she will feel tired more easily. That may influence her grades or performance at school. She may not be able to play with friends actively. That may let her feel upset. So you and the school staff need to remain concerned about her mental health. Because of her age, she needs lots of energy, so you really need to teach her pay attention to her blood glucose in case of losing conscience at school. So just the 3 things for you: insist on administering the insulin, self-test the blood glucose, and pay attention to uncomfortable situation. If we can find the suitable plan for her and insist on that, she can avoid many problems.